My name is Juana Zaig, and I am the coordinator for the Health Information Center here at Pacer Center. Um, Basically, tonight is the second part of the bigger webinar series. It's called Thriving Together: A Family's Guide to Navigating Disability Services. And this particular webinar that I'm incredibly excited about is about navigating healthcare systems with confidence. And the goal of the series overall is to co-create, have this collaboration between parents and caregivers and professionals, and bring families and professionals together. And this webinar does it so beautifully. So I am so very excited to really have Haley and Andrea and Dr. Barr co-present this webinar, and I'm going to give it to them to take it from here. Thank you. Thank you.
All right. Should I kick it off? I don't know.
Yes, please go ahead. Whoever.
Well, welcome everyone. We are so glad you're here. I know people are probably going to pop on over the next 10 minutes. I know it's dinner time. But we wanted to take a few minutes just to spend some time on introductions. So we'll go just in the order of who we have on screen here. So Andrea, do you want to go ahead and kick us off?
Yes. Good evening, excuse me. Good evening, everyone. Thank you so much for being here. I'm very excited to be here. Thank you for holding space for us and taking time to connect with us. I'm Andrea Lawson, maternal child health strategist. I am the founder of Healthy Q Solutions. It's early childhood early childhood excuse me, early childhood development, firm. And I am glad to be here. Thank you.
Hi, everyone. I'm Tori Barr. I'm a MedPeds complex care doctor at Gillette Children's. I have been at Gillette since 2019 when finishing my residency. I came to complex care by way of first being a PCA for a young woman with spinal muscular atrophy, who really opened my eyes to the world of disability and the aging from pediatric to adulthood, which is why I became a MedPeds doctor and am at Gillette.
Thanks, Dr. Barr. Thanks, Andrea. My name is Haley Brunel, and I am so honored and humbled to be, sharing this screen, what are we calling this, webinar, with Andrea and Tori Barr, just two amazing women. I can't say enough good things about them. You will see more and more from them as we go on here. But my name is Haley Brunel, and I come to this work kind of from two places. So I work at Gillette in research, but I'm also a mom, right? Navigating this system every day with a 9-year-old named Felix. He has a rare genetic condition that results in him seeing pretty much every specialist that exists. And I didn't learn any of this from a textbook. I learned it from living with it and aligning myself with people that some are in this world by choice, Dr. Barr, and some that kind of stumble on it because, or it's by accident because we have kids with special healthcare needs. I know many of you here tonight are living this too. And I'm so glad you're here and your willingness to be a part of this community, to be involved. Webinars are a great first step. You'll start to see similar names in there. You might reach out on Facebook. Feel free to use the chat. We want this to be conversational. I don't think anybody can come off mute, but type in a question. Awana's gonna kind of keep us on task in terms of like if there are questions coming in, she'll chime in, come off mute. But that's us. So we'll go ahead and if I can figure out how to work this. All right, my arrows aren't working, but this is working. So objectives for tonight. We want you to learn how parents and professionals can work together as partners, right? We're going to explore practical tools, gain confidence, in taking a leading role in your child's journey through the healthcare system. We want you to live here tonight understanding a little bit more about healthcare systems, how they function from both the parent side and the provider side. So different perspectives. We want you to have some practical tools, some links you can go explore on your own. How to communicate and coordinate care with confidence to really lead in your child's healthcare journey. This presentation is a great example of working together. More and more we are seeing providers present alongside people with lived experience, acknowledging that partnership and collaboration. I am big on New Year's goals and resolutions and things. And this year I said, this is the year, if anybody follows me, this is better together. This is the year better together. And it's this sort of presentation that is absolutely in alignment with that. Like that Jack Johnson song is like constantly ringing in my ears. Anyway, let's go ahead. Let's dig in. First, we wanted to acknowledge the complexity. And this is a real picture of my family. There's a lot of a complexity happening here. That is my mom in the background with my 4-month-old, 6. It's all kind of a fog on her lap there. You can see maybe his feeding pump, the breast pump there's on the floor. My husband is just, among all of the paperwork. It's crazy. We were struggling with diagnosis after diagnosis, learning how many specialists actually exist. This was our reality. This was our home life. Those were all medical bills on the floor, every single one of them, from providers my son had seen in those first 3 months. And it was my first window into the complexity I was about to face as a parent raising a child with a rare medical condition. And medical is just one piece of the picture, right? This slide sort of represents what families and caregivers are managing from a little bit more of a macro level. Healthcare is just one piece, that little, lighter blue honeycomb up there. Aside from healthcare, right, you're also coordinating education, insurance, equipment, medications, therapy, safety, daily life. All the time. There's a lot going on. So I think we just really kind of wanted to paint that picture. And then this gets even more down into the micro level, what that care coordination really looks like. When I first saw this map, I was like, oh my gosh, that's what I do. This is what I've been doing. I hadn't really, until I mapped it all out. And my friend Trisha Brisbane's like, this is called care mapping. We take every little bit of your child's care and put it all in this big sheet. I was like, wow, like I hadn't realized I was managing all of that until I saw it like this. So it was that kind of validation for what I called, I was a stay-at-home mom for 7 years, right? When my son was born. There is a lot of work that is happening. And so I just wanted to acknowledge that. I know Oana had kind of alluded to this in the last presentation. Sometimes people draw these out in a more, organic way. And they can look very different, but there are, some key parts, the medical, the advocacy, education, the system, as I like to call it, kind of Medicaid, Medicare, insurance, safety and accessibility, support and resources, and then how all that gets blown out. So if you feel overwhelmed, it's not a personal failure. This is the reality of the system and everything you are managing. So just throwing it out there. And Tori, I'm going to bump it to you.
So, as you can see from Haley's journey and CareMap, this is a big, multi-dimensional process. Layered on that is that the medical system, the healthcare system is absolutely broken. It's not working for patients, for families, it's not working for providers or hospitals or nurses. And we just wanted to acknowledge that as we start this conversation, that we know it's broken. We are not going to talk about how broken it is. We are instead going to just leave that be because we know that regardless of all the incredible advocacy that so many of us on the webinar are doing to make the system better, your children and your loved ones need care tomorrow. They're going to access care tomorrow. So, how can we make that even just a little bit better? And that's what we're hoping you take away from today's webinar.
So I'm going to go back to my little honeycombs here. And that one blown out as the medical example, right? These are all the different patient portals our family has to log into. Some are just for second opinions, some are, for research. We go down to Texas Children, some we're not doing on a day-to-day basis. And I called out two in particular because one kind of tip and trick for me was that it was helpful for me to kind of pull a lot of these specialists into one, under one patient portal. It was just easier. And so we ended up moving to Gillette, not only for complex care, but for all of these other things too, right? He's seen, pulmonology, PM&R, all the different specialists over there. And then aside from that, he still has to have his primary care provider. So we use Partners in Peds for that because they connect with Children's Minnesota. And we do a lot of things at Children's still, and I think you find your people, and like there are certain ones you want to cling to, and it's all about building that team. But I think the two that I call out and that I use the most are Gillette and Partners in Peds. But there's such a web of how all of this stuff works together, and Tori's going to get into that a little bit later. But I think there's a lot. Unfortunately, we have to learn to work within this currently sort of broken system. And parents are the ones that are bridging the gap, and need the education and training on how to do that. And so that's in part what we hope to be able to provide you with today.
I got some comments here from Ryan and
Oh,
Tony, and acknowledging the fact that this is a very complex, it's an impressive diagram indeed, and it is very important to advocate and speak on it, on the system being not broken, like being broken, and having to do that advocacy to kind of manage it. So thank you. Thank you both.
And having to work within it and know that like we are the glue that holds it. We are the constant, right? As parents, we are the constant because not all of these places are going to talk to each other. And so we have to be always that person that is the historian, is the, so yeah, it's a lot, not to mention like the medications and managing the, the Walgreens and the specialty meds. It's just, every time I look at this, I'm like, oh my gosh, it is a lot. I want to go one back. How do I go one back? God darn it. Did I skip one?
Do your arrow keys work, Haley?
Right. They kept, oh yeah, here we go. Okay.
Okay.
They were beeping at me earlier, but now they're working. So, okay. So one thing we wanted to kind of call out here was just the two different perspectives, right? So for me, the parent and patient perspective of this healthcare web and all of these different, systems and providers, it leads to us viewing it as a parent as kind of fragmented care, right? We're having to repeat our story over and over. The emotional load of having to do that and tell your story every single time over and over is a lot. And then you feel like there's just like you're alone and there's a lack of support. And I think then, from the provider side, they're feeling, similar but different things.
Yeah, I think from a provider lens, we are also working in a very broken system with time constraints that make no sense in terms of being able to see patients in the way that they should be seen, as well as the silos that you're feeling with all the patient portals. They exist on the side of the provider as well, of I can only see uh, quickly and easily the data from the providers and the labs drawn within my own system. And then the other layer that I think families feel as well, but from providers and healthcare, there's this terminology called moral injury. So this is the sense that I know what I want to do for this patient and what is right and what the research says and what the family and I decide together in the visit. And then the reality of making that happen, whether that is an insurance company that is saying no, or there's some social, economic, life barriers that are coming in the way of it, and how seeing that over and over and over again can be really demoralizing to providers and lead to burnout within the healthcare system, which then perpetuates a layer of frustration and hopelessness amongst providers and nurses and the system as well. And then, I mean, there is just a tremendous explosion of new knowledge that's coming out that providers could never keep up on. The number of new medications coming out, the new number of new genetic diagnoses found every week is like 10 new diagnoses every week. So there's no way that you can know it all, especially when you're seeing so many different young people. So in my complex care clinic, I follow over 300 patients that have medical complexity of all sorts of different diagnoses. And with that comes a certain level of expertise. And I mean, I say I don't know all of the time, every day. I don't know. We'll have to figure that out together. But these all add on to the layers of making this more and more complex.
And we are so lucky to have, providers like you willing to partner with us, willing to say, I don't know, but we're going to figure this out together, right? It's remarkable what our providers are doing for us and the constraints that they're under. So after I had the privilege of being able to stay at home with my medically complex child for 7 years, trying to navigate all of this, I decided to think about, having a job and getting back into the workforce after having worked in marketing and brand strategy for 16 years. I had very different criteria for what my job would be. And lo and behold, an opportunity came about at Gillette that met pretty much all of my criteria as a job in research, helping coordinate their family engagement in research program. Please ping me afterwards if that's something that interests you. I'd love to talk to you about it. But I jumped at the opportunity, but then struggled with okay, I've been out of the workforce for 7 years. There's a gap in my resume. I haven't put together a resume in 7 years. And then it kind of dawned on me. I'm like, I was the CEO. I'm the CEO of Team Felix, and I was like, yeah, that sounds good, right? Top of the resume, CEO of Team Felix. And then I listed underneath that everything I was doing as CEO of Team Felix. But the funny thing was when Gillette went to call me, HR went to call me to verify my employment, they're like, we'd like to speak to the CEO of Team Felix. And I'm like, you're talking to her. I'm a mom. they kind of they were confused. And they're like, well, you can't verify your reference for your, anyway.
That's
yeah.
fantastic, by the way. It's so beautiful. I love the visual because it's literally building a resume. You build a resume out of being a mom. Yes.
And but it's true. We're
Yes.
doing so much, especially as kids, parents of kids with medical complexity. Like we are using all the skills that we have, regardless of what we did in our professional life or non-professional life, or just managing a household. Like we are using it all, everything. But it was a way for me to say what I was doing as a stay-at-home mom wasn't really a job. Maybe I wasn't paid for it, but it was my job and I did a lot. And do not discount that ever, ever. It might not be paid work, but it is work. Um, so anyway, they've figured it all out. I still like to say that is my most important job, is that I am the CEO of Team Felix. I wouldn't be doing any of this other work if it weren't for that. And Andrea is CEO of her own team.
Yes, Haley, thank you for sharing your story. I always love the way you put that in perspective. And like she said, we are the project managers. So these are all transferable skills. I mean, you're a project manager, you're probably sifting through data, all of that. So think about that as you're writing your resumes and applying for a job. These are skills that, like real actual skills. I will say, just to kind of add, she said it perfectly, but I have navigated this journey for 6 years now. It's been a challenge. My son was born in the middle of the pandemic, so as you can imagine, I'm sure some of you can attest to how challenging that was. And like trying to build your care team and trying to find the folks that are perfect for you and your child. I've had to fire a lot of folks, and so I have no shame. And so if it doesn't feel right, I feel like with parents, you know if it's a good fit, and if it's not, you just keep checking away. I've fired a couple different providers and pediatricians, and I'm happy where we are now. And that actually is a great segue into our next slide.
It's good to say that. I like to say, like you can fire people. It's okay. If it's not a good fit, if it's not a, you
Mhm.
can walk away and
Mhm.
find someone who is.
Yep.
I mean, maybe fire is not the right word, but you can find a better fit.
Yes.
Mm. I'm
All good. All good. All right, so this goes right into our next slide, finding your ride or die. What does that mean? For me, it's finding someone that is gonna just be lock and step with you. So this would be obviously your medical provider who knows your child best, has your back. I would definitely say you want someone that is curious alongside of you. I always try to keep at a level of just remaining curious, asking questions. So this is really about alignment and not just shopping around to figure out who's there, right? And so it's not about the best hospital or about the most famous neurologist. It's about really like who listens to you, who takes your concerns seriously, and who shows up consistently. I will tell you from my own journey, I've had a couple different pediatricians, and when I found the right one, or at least the way we engage with our providers is if we have a provider that asks us how mom and dad are doing, then that's the fit because my child is not great without mom and dad being good too. And so we think about it as if you really care about the whole family, then I feel like it's a good fit and it has been a good fit. I've sat down with my provider in many different cases when there have been gray areas and said, hey, here's where we're at. I need a little bit of help, and what I'm looking for is collaboration. We may not get it right, but my ask is if you can just partner with me. And anytime we've ever had a provider that has agreed to that, it's always been a great fit. And so those are just some pointers that have worked for me. May not necessarily work for you, but just kind of wanted to share some tips that really work.
So, where do you find a primary care doctor? How do you find your ride or die? So I think there's a ton of support between families and other moms or dads that have children with different diagnoses that you can ask advice for, looking along those routes. There also is something in Minnesota called a healthcare home. In other states, it's called a medical home. But this is a designated clinic that is certified by the Minnesota Department of Health. as a certified healthcare home. And what that means is that they have met certain criteria about how they approach patient care within their system. One of those things that is a requirement of the healthcare home program is that there's some level of coordination, care coordination that is happening. For many people, as you're navigating the system, having a care coordinator or someone that can help with kind of helping decide where do we go next, how do we actually make the things that we talked about with our doctor or provider happen in reality can be particularly helpful. So we can throw in the chat and I can do that, the links to these, but the first one is the healthcare home map. So that is primary care primarily. Our complex care program is a healthcare home, but most of the other clinics are going to be primary care clinics. So if you're looking for primary care, this can be kind of a nice way of identifying a place that has at least designated that they are willing to take on more of the coordination pieces. You also might be surprised that your system is a healthcare home, and I encourage this to be a talking point with your provider and your clinic of, hey, tell me about how you're meeting these expectations of healthcare home. It sounds like there should be some level of coordination and extra support within this clinic. What does that look like? Am I getting that? Should I be getting that in a different way? Can be particularly helpful. Also, in the state of Minnesota, there are certified behavioral health homes. So again, these are similar. So they are clinics around mental health diagnoses that have added supports to help people navigate the system as it relates to mental health diagnoses. So this can be also another really helpful tool to identify places or clinics that have added support around navigating the system built into them.
Question here, mine, not a chat. So
Yeah.
it's almost like a concierge type of setup, right? Where you have a care coordinator that would kind of coordinate, facilitate.
So what I will call out is that this is a certification from the state. So there are different criteria that each clinic has to meet. There are different levels of clinics, so foundational, level 1 and level 2, based on have they met the certain criteria. Different clinics are achieving the level of coordination differently. So I think that's why this is more of a conversation starter than saying I'm going to get XYZ as a result of this being a healthcare home. But I think it helps have a conversation about what are those resources that might not be first on the top of mind from a provider as you're seeing them, that might be able to help get you some added support from the primary care lens.
Perfect, thank you.
Yep. Next slide. And Haley alluded to this and in the chat as well. One of my partners was brought up, Heidi Davis. So I work in the complex care clinic at Gillette Children's. So complex care is a relatively new specialty kind of within mostly pediatrics. Some places in the country, there's a little bit of adult complex care. Currently, it is a specialty that is not like a board certified specialty or anything like that. It is a group of providers that have kind of carved and created this, noting that children and young adults with medical complexity have unique needs that may be better served in a different way. So every complex care clinic is slightly different in how it approaches things. I'll talk about the Gillette Complex Care Clinic because that's what I work within. Some complex care clinics across the country actually serve as primary care clinics. Ours does not because of numerous reasons, but we are more of the subspecialty model at Gillette. So we now care for nearly 1,400 young people, 0 to 26 plus. There are 8 of us providers, both nurse practitioners and physicians, and we work as a team with our nurse care managers, our care navigators, which are our specialized schedulers, and social workers. And we really see ourselves as disability and complexity experts, of being those people that can kind of take that 10,000 foot view of what is everything that's going on, kind of going back to Haley's honeycomb care map of like, how does this actually come together? Where are there two doctors that are telling you to do the exact opposite things of each other, and it doesn't make sense together because people aren't seeing the bigger picture? Um, given my background, am really interested in that transition. So thinking about transitioning into adulthood and what happens as young people with complexity age into adulthood. So it's really thinking about care as a team. Um, Many of our patients have medical devices, polypharmacy, which just means they're on lots of medications, multiple providers, and really see ourselves as bridging specialties and systems and coming together as well.
I will say, not to be too rah-rah Gillette, but like complex care is my ride or die. Like it was when I finally got in there, it took me, I don't know, a while to get in there because it was just kind of starting up when Felix was born. And I remember when I got in there, I'm like, I'm kind of fragmented, seeing all these different specialists. And then I have somebody looking at the whole big picture and helping me prioritize things. And I was like, thank you. Thank you. And not only that, and I don't know, Tori, if you mentioned this, and maybe I was tuning out for a second, but we have a dedicated nurse that helps us, and a dedicated scheduler. I mean, those are just such helpful people. I mean, it's I can't say enough good things about it. And are there qualifiers to using complex care?
Yeah, so different clinics are going to have different models or criteria for admission.
Okay.
At Gillette, our model is quite loose in terms of we understand that medical complexity can be complex because of all of the medical things. And it also can be complex because of all of the social life, environmental things. So our main criteria is neurodevelopmental diagnosis with some manner of medical complexity, which is defined loosely. So that might be that there is a feeding tube. It might mean that there's a really rare diagnosis that no one really understands, and we want to make sure that we're kind of hitting all our bases and really thinking holistically about it. And different, I mean, Gillette has kind of neurodevelopmental brains bone movement as kind of where we fit in the larger piece. But other hospital systems might have complex care programs that are geared more towards other diagnoses specifically.
But I think knowing what to ask for, like, hey, are you a complex care clinic? Do you have these services? I mean, it's all about knowing the right questions to ask too, to find your ride or die, to find your team, right?
Haley, could I ask just what you said was so impactful, like knowing what the questions would be that you would need to ask. So how did you figure that out? How did you figure out what questions to ask?
To see if my son qualified.
Yeah.
I mean, I guess I had just heard that if you see multiple specialists, you kind of needed somebody to put the puzzle pieces together, because you've got one specialist telling you one thing, one specialist telling you another, and you're going like, there are not 30 hours in the day for me to be doing all the things. Like, it's impossible. So I need somebody to help me prioritize? Like what do I need to focus on? How do I like set goals, maybe for the year and you just need that. You need a partner. You really need a partner. Does that
Thank you.
answer your question? I don't know. Oh, and this is a great, kind of segue into like you have to build it beyond, right? Just building your care team. You got to build your board of directors.
Thanks, Haley. So we talked about being the CEO of your care team. We talked about finding your ride or die. And now we're talking about building your board of directors. And so what does that like truly mean? Consider your board of directors a group of people who help you think, plan, solve problems, and stay grounded as you navigate the systems. They don't all do the same thing. So as you can see, it could be parents, it could be therapists, it could be community organizations, nonprofits, cultural brokers, and advocates. But you shouldn't necessarily be navigating this all alone. And so think about how you want to build that. And you can choose who you want to be as a part of your board of directors. But these should be individuals that help you navigate understanding a diagnosis or want a second opinion. I probably have two board of directors. I got the folks that I can go to like right away and get the quick answer, and I have like my just general board. Um, but you probably already have that, but you also need someone that's going to help you navigate your emotional support. Obviously, as parents of children with special healthcare needs, it can be an emotional journey. A lot of the times, especially getting a diagnosis right away, can be very isolating. And I think about some of like our underserved communities where having a disability could be considered a spiritual occurrence or taboo. And so, how do you navigate these conversations? So it's really important to build a team or a board of directors that really are there to sit in it with you, I guess, for lack of a better word. But you want to have folks that can help you advocate and help escalate concerns because times get hard. And I know from people in my community, after receiving a hard diagnosis, some folks have to take time off take time off of work to process and navigate. And so sometimes I think about just our journey and just kind of the system being broken, right? It's almost like you're forced to get a diagnosis. Okay, go figure it out. And it's like you still have to process like the mental part of everything. You're grieving. There's so many different emotions. You don't know where to start. And the one thing I will say is Minnesota is great in the sense of we have a lot of resources, but sometimes they're not as visible to certain folks. And so it's important to make sure that you're building your board of directors to kind of help shine a light on some of the things that you may not necessarily see. And yeah.
And I think it's important to note that we're not talking about a formal board of directors, not a formal CEO. This is just kind of like, hey, align with some nonprofits, find your tribe. These are great ways to do it. Start looking at who's in the webinar with you, who's signing up for these things, who are in the Facebook groups. Reach out to them. Friendships will form. We find our people, and Pacer is a great place to start.
Yeah. And I will just add, I know for some families it could be a little bit isolating, especially just being able to take that first step. And I think for me, I was grieving the fact that my community was changing, right? And so I was challenged by my son's speech therapist one day, and she said, "Hey, you should get on Family Advisory Council one day." And I'm like, I don't know, because I felt like maybe some of these children had more complex issues than my situation. And so I will definitely say that was probably one of the best things I ever did because I learned so much. I learned how to navigate the system. There were so many things that I didn't know. Again, in this space, you don't know what you don't know. And so the power of community is really big. And so I would encourage you all, especially for those folks that are kind of new on this journey, um, take some time to reach out to folks. I mean, we're all in it together. It's a lifelong journey. And so you know who the folks that are passionate about this work, you'll know right away. And I'm sure as you're learning on this journey. So yeah.
If I
But
can
get
add super
involved.
quick here.
Yeah.
The purpose of this whole series is to build that community. So in whichever way you want to do it, we are here So reach out and definitely send an email if you want to be added to a list. We can even get started with a group, but there's so many options and groups, parent groups that are available. And we'll share information on a guide at the end of the series, a guide with resources for everyone, and you'll have access to those too. Thank
And
you.
you got to cast your net wide too, because it's like, I mean, it's a small community and you don't always get along with everybody, right? You'll find your people. You got to try a little bit. And you might have to meet a few different people, and like then eventually it all comes together, and it takes a little while, but you will build your board.
Yeah. Voices is a great resource for parent groups. Absolutely. And they're our partner in this series. So yay to Family Voices.
Yeah. So next we're going to talk about knowing your child's baseline. I'm going to say a few things and I'll yield to Dr. Barr to give some insights. But I think it's important to know your child's baseline when you're going in to see a provider or whoever is part of the care team that you're going to visit. Dr. Barr, I feel like Dr. Barr is one of the rare ones. She's probably going to laugh at this. But we got to protect her at all costs because Dr. Barr is a rare one. And she even said that she loves seeing updates about her patients or in her in the children in society. And one of the things I've had to learn on this journey is how to find ways to embed my child in society. And I actually document like the journey and like all the fun things. And I also document some of the things that are not so fun. But at the same time, I find solace in the fact that we've made progress on our journey. There's so many milestones, and our milestones might not necessarily be what the standard says, right? And so when you're going to your provider or whoever is going to be assessing them or seeing them, it's helpful to have a baseline understanding of where your child is at and share that information. So whether it's how they're communicating, how they're moving, if there's any specific sensory preferences, likes or dislikes, joys, anything visual. Dr. Barr did say she loves photos, and I'm like, I've never heard of that, but that's great. Um, I definitely will say I typically at the beginning of the school year, I have a document similar to similar to the one on the PowerPoint slide, but it literally starts off with like my child's favorite colors, things that he likes to do. It's really person-centered, so it really focuses on what's important to him and what's important for him. And we also break down how to communicate with him. In a perfect world, I also feel that instead of having to train the world or teach the world how to engage with children with special health care needs, it should be the other way around. But because it can certainly get tiring doing that. But I do find like having a document like this and being able to share it with folks, it helps with having to not have to repeat your story, but it also gives providers a baseline of where things are now. And you can kind of track that way. And so I'm going to yield to you, Dr. Barr, if you have any insights or want to add to this slide as well.
Absolutely. So, my favorite way to start a patient visit is with some sort of a picture, or what are the highlights from the last 6 months, year since I saw you last? What are the fun things that you did? I love, love, love getting pictures of kids swimming at swimming lessons or doing equine therapy or, showing off their new wheelchair. These are things that I have to write letters of medical necessity for, fill out lots of forms behind the scenes, and it's really valuable to see like this is why I'm doing it. So I actually have a folder in my inbox that is called Joy, and it is where I put any email, picture, like thank you note. And it is normally where I go when I'm on hold waiting to do a peer-to-peer with insurance of like, why do I do this? Why do I do this? Why is the system so hard? So I think it means a lot for providers to be able to see your children out in community doing things, birthday parties, what have you. I also tell every resident I work with who spend a lot of time in the hospital. I no longer work in the hospital, only outpatient, but I always ask when you see these young people in the hospital, you're not seeing them at their best. And it is so valuable to be able to say, do you have a photo of kind of a good day, a video of a good day? What are we trying to get to? What is baseline? And there's nothing better than, the giggles playing with older brother, or that is so meaningful to help people understand, because in the hospital is not where you see our folks with medical complexity or medical conditions really thriving. So it's really helpful to frame it for people. So I encourage you to, hey, he had his birthday. Look at this cool picture of him doing XYZ, or uh, at Special Olympics. It's really valuable and brings humanity to the table. And I will say my MAs, my nurses, they love seeing it too. So they don't like just giving vaccines. They they love to be a part of it too. So having one or two pictures ready to go can just kind of start the visit off on a different note.
I was saying earlier, like we all need a joy folder, like the go-to folder when things just get too heavy. Like, can we all go there and just like, where are the things? Like, why do we do what we do? Remind me, because
Yeah.
it gets hard.
It is hard. And part of that is hard is that information is hard to come by. There is so much information. One of the downsides of the electronic medical record is that it's easy to put a lot of things in there, so the important stuff can get lost. It also is a system that is very fragmented and very confusing as to why sometimes you can see records outside of the system and sometimes you can't, and why the glitches is happening today to be able to find the records. And unfortunately, this leaves parents as really being that keeper of all of the information, which is frustrating for all involved. Um, so next slide, I'll talk a little bit about why that communication between systems is challenging. So different electronic medical records do not communicate with each other. So a health system or a clinic will buy their medical record, and they will have the medical record that can communicate with anyone that is has a login for that medical record. Then medical record system said, well, can't we communicate between some of them? So that's where you might hear things like Care Everywhere or Commonwealth. These are like links between health systems. Now, in order for that link to work, once a year when you sign in for your appointment, you'll get all these like releases that you need to sign for like privacy, the HIPAA rules, and consent to treat. And one of the newer ones that you might be seeing is something called like Health Information Exchange. And that paperwork allows a health system to then say, other people outside of our system can see those records. And that's where those links come to be. In order for that
People
link,
that you give permission to, right? But you have to give the permission.
you have to give the permission, yeah. And so you also need to have given permission on both sides. So if you gave permission at Gillette in January, but you didn't give permission to Fairview, I can't see the Fairview stuff, even though you told me that I can look at the Fairview stuff. It needs to get unlocked through signing that form at Fairview too. So it's very frustrating, but I encourage everyone to sign those things to try to allow for these systems to work better. A lot of this is all guided by the HIPAA, which is the Health Insurance Portability and Accountability Act, which is somewhat overinterpreted in how strictly people follow this. But this is meant to protect patients from their information getting to others, but certainly contributes to that fracturing of and siloing of information.
Dr.
I
Barr, question in the chat. Is it the same with the exchange of information, like release of information, if the provider is in a different state?
Yeah, so we can see things from out of state as long as you're signing the information exchanges. So those exchanges typically aren't state, they're more like Epic or Cerner, these products that are the electronic medical record. Um, and then, like I said before, the electronic health record is just, there is so much there. I'm sure you've seen on your discharge summaries of your problem list, which is the fancy word for like, here are the medical diagnoses that you've been given. And it is, there's just a lot of things. It could be, you could have the same diagnosis listed 4 times but slightly different, like spina bifida, myelomeningocele. Like they mean the same thing, but they're listed on there twice, which just leads to a lot more that people have to dig through. And then just there's a lot of time constraints. This is a very time-intensive process of gathering records. Hopefully with added technology and AI, there's all sorts of things that we're getting, bombarded with of try this, that will make it better. But right now, the communication between systems is tricky.
And
So,
whenever you're going into an appointment, just ask, just say, hey, do I need to sign out? Am I due for a release of information? Like, I might, because you never know when they usually time out after a year or two, don't they? So I'm constantly asking, and what do you need me to sign to communicate at least, right, with the big
Mhm.
ones, like to make sure Gillette and Children's are able to communicate.
Yeah. So, what can you do now to make this a little bit easier? So, one, of course, signing those health information exchange consents when you get them. Secondly, when you're thinking about building your healthcare team, I spend a lot of time talking to families about this, especially as they're transitioning to adulthood. But reflecting on, you have a list of things that you want in providers. Sometimes it is, I want someone close to home. Sometimes it is, I want someone with a certain identity. Sometimes it is, I want someone who understands a G-tube, etc. But I would just encourage you to also add in kind of your list of how do I choose a new provider is how well is this provider going to be able to communicate with the other providers? So just like Haley said, it's important to me to kind of try to keep the number of portals down, right? Like I want to have as many providers in one place. Also, when the providers are in the same place, that means that we can, like behind the scenes, secure chat. We can send messages to each other. That if I need to talk to a provider outside of my health system, I also have to call because there most of the time is not a backdoor number. I also call, and sometimes I can bypass to say like, I'm a physician from an outside facility, but I also am on hold waiting to call and get a call back from another provider. So the more you can kind of think about your team as within the same system, that helps you and it helps providers to be able to take care of you. Plus, then the information is in the same system, so there's less risk from just a safety standpoint, too. And then patient portals do exist now. I encourage you to spend some time familiarizing what is on there. There should be quite a few things. You should be able to see your appointments. Now, all of your lab testing typically gets to patients the exact same moment it gets to me. So most patients get their labs before I ever see them of what that looks like, which is can be really helpful in terms of you have access to all the labs. So if you end up at the ER somewhere else and they don't have access to your labs, you can pull up the portal. I look at people's portals all day long of like, how can we bridge this gap that exists? And then a few years ago, there was a law that was passed that said patients need to have access to their full medical notes. So you should, in all of the portals, also be able to not only just see like your after visit summary or instructions, but there should be a part on there where you can actually read the entire note that your provider wrote based on their visit. And that can be a nice way of just like refreshing of like, okay, what did we talk about? And then also reflecting on is that what we really talked about? Are we on the same page of what's going on as well? I also have families pull that up so that if I don't have the record, then I can actually read the full note as well. The other thing can be nice if any of you work with people that um, English is not their first language. Sometimes the portal gets um, is not accessible to them. I mean, most of the time it's not accessible to non-English speakers. Um, but sometimes it can still be really helpful for them to have a password to be able to log in. So when they are at other visits, they can pull it up and the healthcare team can help them utilize it to figure out how to best support families. And then the last,
I'll add one quick
yeah,
thing
yeah.
about the portals. Like if you're not on one of the I mean, it took me a while to get on one. But then it was so much easier. And if you're not on them, just go into the front desk, have them help you out if you need help logging in, and like they can help walk you through it. While you're there, just make it happen. Next appointment, just do it. I promise you it will make your life easier.
And then the one thing that I find incredibly helpful for people to have is to keep a list of who your healthcare team is and where you get your care. So on the next slide, you'll see this is a version of one I stole from one of my patients. But basically, it's quite simple. Who's the provider? Where do they work? What specialty are they? When did you see them last? And when is your next appointment? And then the purpose can be helpful too. But this one document can help in so many ways. One, it's hard to remember names. Two, when I'm asking for medical records from other places, it's nice for me to have a date so that they can actually pull something from them. And then can help keep you organized of like, when are all these appointments coming? Oh, I mean, the number of times when you have 20 providers, 10 providers that you forget, I haven't been to the dentist in uh, 3 years. These sorts of things can be really helpful to just keep you organized.
And I'll add that I created, I did a spreadsheet like this and I put it in Google Drive so that I can access it on my phone. And I also added contact information. And one really helpful thing for me, as you're starting to get into waivers and all of those things, they say, you need to list your name and contact information for all your providers. And I go, are you kidding me? And I'm like, how about a link to this spreadsheet? And that's what we do. And it saves me so much time. I did it once and then they get a link. And then once they have the information that they need, I, unlink them from the sheet. But it's a time saver. I think we're gonna, here's another one. So I know several people are talking about charting the life course. And it is very deep and very wide. And so, and it's a great tool. What I will say here, while we're talking about tools and things that can help keep you organized, there's a link at the top of this page. We'll send these slides to you. This will take you directly to the healthcare portion of charting the life course. Like I showed that honeycomb image, Charting Life course has their own very similar sort of image with all the different aspects of managing someone with a special healthcare needs. This starts to get into some of the tools that will be helpful for you to know which questions to ask, to keep you organized, to start thinking about okay, what does my best day look like? What are goals for my child or our family? And start, just giving you a framework to work around. There's pros and cons to this. I think it's as one of the better tools that we have available to us. Um, but it's not interactive. So you can download them. Some of these you can fill in if you download the form. Each one of these is downloadable. You can download the form and you can enter information and then save it on your own computer or upload it to a drive or something like that. It's not yet fully, editable or digital. In a perfect world, we would create an app or something that we could easily do this, but it's getting there. It's a step in the right direction. Like we said, we can't change everything right away, but we keep taking these baby steps. So Charting the Life course, these links are really helpful, I think. Andrew, I'm going to bump it to you. So we've been talking about like, what happens up until you get to an appointment. And then as you're in an appointment, when you're talking to your provider, what are different ways that you can do that?
Thank you, Haley. So, as you pretty much can probably attest to, medical trauma is real. Many of us have gone through various forms of trauma on this journey. It's real for parents, it's real for caregivers, it's real for children. And the conversation that we've had amongst ourselves is, how does a provider meet a patient where they're at or a family where they're at and vice versa? And by the time I would say sometimes by the time we get to a provider, or even a specialist, we're on the struggle bus. I don't know for lack of a better term. We're going through it. And so one of the things that I found helpful is that you can actually be passionate and curious at the same time. You can certainly be firm and collaborative at the same time. And so we thought it would be helpful to put together a few different talking points on how to truly convey concerns in a manner that is digestible or meaningful. And I had a conversation with Dr. Barr, just asking her, what would be helpful as well. And she gave some great tips too. And I can also just share some of mine as well. But one of the things that we talked about is like, what are the things that help take the pressure off you and your family at the moment? So is it sending a note or an agenda before you actually attend the appointment? So that could be in my chart, or maybe giving it to the nurse at check-in. You can bring your notebook if you have some notes. If you have, I keep notes in my phone sometimes so I don't forget, because this life is happening, life is lifing. You can bring whatever helps you get through your appointment. And one of the things I typically do, because sometimes time is so, we're usually in a tight time constraints. I like to start off with what I want to accomplish today, or what my objective is today, just in case we go off on a tangent. I know where we need to go back in the line, or at least try hitting some of the important topics first, before everything kind of goes elsewhere. And so the one thing that is helpful is just when you need to realign, or when tensions do get a little hot and high, you can certainly remind your provider or whoever you're speaking with that we're all on the same page. We're all on the same team. We're just trying to work towards a common goal, even though it may be hot. And two things could be true at the same time. Provider could be frustrated, parents could be frustrated, but at the same time, as long as we have a common goal in mind, that's all that matters. And going back to kind of just being the CEO, right? We want to make sure that we're centering our child in the middle of all this. And so, yeah. Haley, Dr. Barr, any insights or feedback on that? Think we probably covered it, but I just wanted to yield to anyone.
Yeah, I would just say having the list of things you want to talk about prepared and ready to go and given is really helpful to help kind of navigate. Often the provider has things that they want to make sure we gotta like get these annual labs, or we gotta make sure we talk about this. So it helps navigate, okay, what are the priority items? It also offers an opportunity of saying like, we're not going to get to all of this. Like this is more than one visit. Let's set something up upcoming. It might be another visit, it might be another virtual visit, a telephone call. And I encourage you also, if you had your agenda, like I wanted to get through all this and we didn't, of at the end of the visit asking, if someone says, I'll follow up in 6 months, like, no, actually, I have these specific things. Can we set up something in a month or in 2 weeks or something like that to continue the conversation?
And it doesn't have to be an in-person visit. Maybe it's a follow-up phone call or some.
I think this
Absolutely.
is so powerful, and going back to the language, to reframe the language and
Yeah.
just instead of try this, I loved it because it's part of advocacy and doing it in a meaningful and impactful way with a lot of compassion on both sides. So thank you for this.
Yeah, our providers are not always seeing us as parents at our best self, as our best self. Sometimes we're in there and we're just a hot mess, right? Um, Andrea, this is.
So then this is a great segue into the SBAR.
Mhm.
For our folks on the call that are work in healthcare, this probably looks really familiar to you all. But for folks that may not be familiar with this, so a little bit of context. This is typically a structured four-step communication framework that's used in the hospitals or I feel like in clinical settings today. But historically, it originates from the Navy, which I didn't even know because I like looked it up. But essentially, it's used as a tool to ensure effective communication. And providers use this as a means to talk to each other, or allied health professionals use this as a way to communicate straight to the point. And thought it would be a good idea to adapt it and turn it into something that we all can use. I actually use this in a way to communicate to certain folks. Sometimes I know that folks that just need the bullet points. I use this as a way to really convey my thoughts, and it's always been helpful. It doesn't really matter whether it's clinical setting or whatnot. You could probably use it with your spouse, your friend, whoever. It's very useful, but in a more adaptive way. We took upon ourselves to create an adapted version that is parent provider facing and friendly rather. And so typically stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. And so when we translate into our world, situation would be what's happening now. So this could just be a one sentence, one liner, what's happening now. Background is where you kind of give a little bit more background and detail, like a paragraph or so. And then assessment will be, what are you noticing? What are you seeing? What is important for the doctor to actually know? And then the recommendation would be, what are you asking for? And what would you like to have happen? And I think this is a very powerful tool for providers to have, especially from a parent or caregiver facing way. Sometimes it is hard to communicate, especially in very high stress situations. When you're communicating on my chart or if you're sending a note, it could be sometimes you might not be able to convey your thoughts correctly, but this is a great way to kind of align and organize your thoughts and communicate a little bit more effectively.
So, we are about 20 minutes until our webinar wraps up. So I want to make sure that we have time for questions and things. So please put them in the chat while we're kind of talking about some other things that you can do right now.
And
So
people have been asking questions, and I've been asking questions as we went, which is great. So far, no questions.
perfect. So we
So
just
then
want to
we're
make
great.
sure that we
Yep.
don't
Yep.
we want everyone to have the opportunity to ask anything that you wish. So, but we'll talk about some other things as people are reflecting too. So,
And
um,
they're sharing resources too, which is fantastic. So
yeah,
apps and all of that. So people you'll go back, you can go back and look at those too. So
perfect. So what can you start doing now? So when you start to notice that something's different, I encourage everyone to start kind of tracking what's going on. And it just doesn't need to be like minute by minute, we're charting everything that's going in and every poop, just like you did, the first 24 hours of your baby's life. Um, but like kind of tracking. You've all been at the appointment where you're like, well, something's just off and like, oh, they've had a fever, but was that 2 days ago or was it 5 days ago? Or, like it's hard to remember in the days of life. So, even if it's just on a calendar of just like fever today, didn't eat as well. It doesn't need to be super elaborate, but can help when it rises to the level of like, oh, I got to seek care for this. To just be able to be a little bit more efficient in being able to describe that. One of the things, like I do a lot of constipation, pooping management. And so being able to know how much they're pooping and what medication was actually given um, seems like pretty straightforward when we're talking about it here, but like in reality, it's hard to actually keep track of poop and what meds were given and did we try doing this or that. Try to reflect on that. I think some of the things that I've had families come in with is just a printed off blank calendar and they just write, like poop, Senna, poop, Miralax, whatever it was, didn't poop, didn't poop, didn't poop. And that visual is also really helpful for the provider to see as well. Um, and when you start to notice more urgent things, how are you going to flag those when you're keeping track? Or how are you going to flag them between caregivers to identify this is something that we're paying attention to today? I noticed this. Andrea?
I was just going to say thank you for just sharing and lifting up the desire to keep track. A lot of the time, especially when my son was really young, I mean, we would get questions of like, what did the poop look like? And I'm like, I don't know. I just want him to live. I don't know. So we weren't focused on that. And so even now today, he's doing better and he's making progress. But um, for many of our children that have more complex needs, obviously constipation is a big deal. GI issues is a big deal. Anytime my son starts getting sick and we know, like, it's almost one of those things where someone gets a cough, we start looking around like, oh my God, we just got through something. But we'll just take a piece of paper and tape it on the counter, and we'll just, if we're giving dosages of, Tylenol or whatever, we will document that. We'll just do the time. We'll do, how many milliliters or whatever the dosage or whatever, and then if there's any reactions or any notes, and that is always helpful, especially when it comes to like calling the nurse line, especially in the middle of the night when you got one eye open, oh dark 30, you don't even know where you're at. It's always helpful to have a piece of paper or something to like refer to. And so I would encourage you all, if you have a better system that works for you, it's just helpful from a communication standpoint to at least have a baseline of like what's happening, so that they can better triage you. And I feel like it helps us get into places faster because we know we know what has happened in the past and where we are, and they're able to help navigate and coordinate care, especially in emergent situations.
I have whiteboards everywhere. And it took me 9 years to be like, oh, he started coughing, like, okay, what day is it? What did I give him? Um, it took me a long time because then I realized, oh, every time I go in, they ask me the same thing. Like, when did it start? What, what did you give him? When did you give it to him? When was his last dose? Yeah, so important to keep tracking those things
And
for
people
sure.
in the chat agree that tracking is very, very important. And sometimes it's hard to know when to go in. As we
Yeah.
manage, Brittany says that we manage so many emergencies at home as parents in nursing that it's hard to find that fine line. The hospital is sometimes dangerous, but with the germs, which is very true. But then keeping that track on the phone, like a brief track of things on the phone, or it could be a whiteboard like Jeannie's doing. So yeah.
I would just
And also give yourself grace. You can't
Mhm.
track everything.
Mhm.
So if you're only tracking when like something's different, we're just going to track for this period of time. That's great. The other thing that I have, if you're tracking it, it's okay to share with the provider too. The number of times where like families are investing all this time and energy in tracking, and then I don't see it, like pains me because I have most definitely diagnosed things that others have missed because that document wasn't shared. And like when you can clearly see, oh my God, like I have this patient who they were tracking every single urine output. And it was like this is like I was able to tell just by looking at it, like here's the problem that is happening. And we made the diagnosis of this kid who had gone a couple of years, and mom had notebooks dating back a couple of years of everything she had been tracking. And no one asked her to see it. So show it, show it.
I was just gonna add shout out to Brittany because Brittany, you're really raising some great points. I will definitely say knowing when to go in has always been a challenge, right? And so I started asking questions, and now I usually when we leave or if we are di or if we're admitted, I would ask, when do I need to come back? I know like the discharge paperwork will like say like call the nurse if you see this XYZ, but like I need to know from you as a provider. What is something what are the symptoms or what are the things I need to look for when you're like, hey, your kid needs to come back? And typically we have kind of like our baseline, and that's when we start calling and like, hey, should we come in? What do you think? But it's a lot more settling knowing what we're looking for versus just kind of trying to ride it out. You know, when you have a kid that can't barely breathe in the middle of the night, they got a cold, you're sitting in the bathroom, running the water with steam and all of that. That's yeah, it gets old after a certain point in time, but I would encourage you all to ask questions. I just remain curious, ask questions, and even talk to the nurse line, but it makes it much more easier when you understand kind of like your baseline for your child and like what to look for. So,
Yeah. And even in the partnership piece of things, just asking for what should I track? Like, there are all the things, but like, what is actually going to be important? We made this medication change. What should I be looking for to know whether it's helpful or not helpful? And then the agenda. Agendas are important. We want to know what you want to know. Um, it's important.
But what I would add super quick here is that, like, I personally, as a mom, I'm thinking, am I overreacting here? And going in and being kind of a little bit dismissed sometimes, or feel like I'm being dismissed. And it's just, it's a fine line still. And that's why tracking to me is very scientific. And you can't miss, you can't go wrong with it. So thank you for that.
I think we're gonna skip along a little bit quicker here. This is just, a slide to say like, at some point, most of us end up with this, unofficial PhD, not because we wanted one, but because our kids needed us to. We needed to understand all of these things. I think this was a friend of mine. I stole the term from her, but I like to think like, and shout out to dads and to grandparents and everything out there. But yeah, we're all earning our doctorates in medical mammology. And just, reminding us all we're better together. It's all about having that curiosity, partnership. Just we're continuing to create progress. And practical tools, takeaways. Here are quite a bit of links that we want to be able to provide you with. I'm not sure who wanted to speak to this slide.
yeah, I'll take it away. So we just wanted to share some resources, and I was going to say thank you all for sharing a lot of the resources in the chat. There's things that I've never seen before. So again, this is where the power of community is important. So thank you all for doing that. But we figured we share a few different links. Again, this is not an exhaustive list. This is just a few that we wanted to pull out. Obviously, Pacer Center has a number of different resources and guidance that is available. The American Academy of Pediatrics does have an emergency information form. I took a look at that. It's awesome. It is a lot of lines in there, but I do think about how helpful it would be for folks that are caring for your child to have. And then Family Voices has a number of also amazing different resources that you can certainly tap into specifically related to our discussion today. And so feel free to take a look at those, and I believe we'll send those out as well. Um, as we kind of slowly kind of wrap up our call, I would just want to just say one thing for me is always remember to celebrate in the hallway. This journey is not linear, and that is something that I always I have to practice. I'm getting better, but this journey is not easy for a lot of folks. And remembering to celebrate in the hallway, I feel like it brings a lot of I find solace in that. So I'll yield to the rest of my team to add any final remarks.
Yeah, I think I'll just this is if you click on that QR code, these are just I tried to map them out on like this, like here's kind of connection and quality of life up at the top and education over off on the right, and like where do some of these organizations fall on these axes? Some are more advocacy focused, some are more system based. So these are just organizations and resources that I've run across that I find helpful. If you snap that QR code, it'll bring you to a site that just it has a one-liner about each one of those and how I find them helpful.
And the
Yeah, and
guide
I
that
think
will
just
be sent at the end.
pardon?
We'll include all of these in the guide that will be sent at the end of the series. Everybody,
There'll be the QR code that'll be in there that you can
great.
get to
Yep,
all of these, but just
right.
just knowing that there are all these other resources out there. This is where we find community, get involved. There's so many. For me, it's helpful to kind of map them like this to like, okay, if I need more connection-based things, I might be, looking at Hope Kids or, Highland Friendship Club or something like that. If I'm looking at more systems change, maybe it's got transition or research or the Rare Disease Advisory Council. So those will all be in the PDF that we send out.
There
And
was
we're just
another
wrapping up quick.
Question, there's a question in the chat
Yeah.
from Audra. My
Mhm.
child is 19 and will need to move to adult care. What recommendations do you have for this transition?
Sure.
Good question, Audra. So this is a big change in terms of transition to adulthood. It takes healthcare coordination and navigation to a whole new level of learning a new system. One of the hematologists at the University of Minnesota talks about this transition from pediatric to adult care of going from like small town environment in the pediatrics world where all the providers kind of know each other and they're friendly. The hospital system is really set up for young people with um, uh, medical diagnoses or cognitive diagnoses. And then in the adult system, it's like the big city. There's freeways, no one's like helping you get from one place to the other. So it is a huge change. And some of the skills that worked in pediatrics still work in adulthood, and some don't work as well because the whole system is set up in a much different way. So I think there are several things that can be helpful in this journey. One, me and my partner, Peter Ladner, are both MedPeds trained, and we love helping families through this journey through the complex care clinic at Gillette. So we do this all the time. We also have a healthcare transition echo, which is a series of learnings that I put in the chat as well. It's a learning collaborative. There's old webinars and things that we've given, and that can be helpful. We also have a healthcare transition summit once a year, which is for both families navigating this process as well as care, as well as the medical team to come together and think about how do we do this better. That will be May 18th. I can find the link for that as well in the chart. And then the last thing, Haley, if we go back to slide, what have you, 22. So this is a slide of kind of like who are all your care team. What is a nice kind of starting off point for families is if you have your medical team written down of here are all the providers that I'm seeing. 20.
Which one? I don't have the numbers.
Oh, it would be like right before the Charting the Life course. So in this slide, if you changed, okay. Oh, go back one. Okay, so if you do provider specialty when you last saw them, but under the purpose, if you start reflecting, and instead of purpose, put transition plan, and then start talking with your providers of what is your age limit? Where might I be able to get this sort of care into adulthood? Um, can be a really nice starting off point because what you want to think about is in which adult system are you going to want to kind of plot most of your care and then kind of build out from there. So Dr. Ladner and I, we do this kind of in a formal way of kind of thinking about are we doing all the things we should? And then in addition to your health care, then there's the components of guardianship, and if that's important, navigating other insurance changes, educational changes, living environment, all of that are coming along. But
And if I can add here, God Transition has a fantastic tool that can be used in schools as part of your child's IEP to get started on transitioning from pediatric to adult care as part of one of the goals that your child can work on with the school team. So just know that you have that option, and I'm going to, yep, God Transition, there you go.
Yeah, I mean, we're right down to the wire here. Feel free if there's more questions in the chat, otherwise we can wrap up.
Not any more questions that, there was a mention from Brittany about listing some sibling supports as well. So thank you for that, Brittany, very, very much. We'll include those. And if we can get a list of helpful links for the transition, as my son is 21 and will be done with PEDS next month. So Kelly, if you have any transition resources, that would be fantastic. You know what would be cool? To actually have a follow-up webinar to this just on transition with the same group here, or if you want to, but Dr. Toribar for sure.
Come to the summit. It's a
There you
whole
go.
thing,
Yep.
right? I mean, it's really been well organized. I attended it the last 2 years, and my son's 9, and I'm like, okay, I got work to do. It's good to know, okay, at 13 these things will happen. Maybe at 16 we need to start talking about this. So it's never too early.
No, not at all. For someone who did not do it in time, I'm telling you, do it, start at age 13, 14 if you can, or earlier. But yeah, no other questions that I can see here. Thank you all. Brittany says, I just want to personally thank you for putting this. Oh, I was feeling completely overwhelmed yesterday with doing all of the things to the map, and I stumbled across this by accident yesterday. I feel so empowered and grateful. I'm almost teary. Thank you guys. Thank you, ladies, so much. It is about building community, and you've been graciously so kind in giving your time, a lot of time that went into preparing for this, to create the content and then to deliver it. We can't thank you enough. Absolutely, yes. And with that, I mean, if you have any kind of suggestions, folks, and participants in the audience, please fill out the survey. We would love to hear your feedback. If you have any thoughts on what you would like to see next as a continuation to this, because each one of these topics each one of these webinars could go on its own little trail of like topics that we could cover on for example, on this one for healthcare, it could be a series of another 5 or 6 webinars that could be done. Some on transition, some on some other things. So yes, so the slides and the recording will be emailed to everyone, right, Jamie?
Yes, we will. If you don't see, you'll get an automated email tomorrow around 6 p.m. and we'll try to include as many links in that as possible. But if you don't see them in that email, we'll do a follow-up email separately and sometime early next week, Tuesday or Wednesday. And Lana, I'll also mention, I'll capture the chat session, and we can include that as a link also, since there are a lot of resources listed there.
Yeah, and I usually take as a follow-up to the webinars, and I know we're right at time, but I take the chat and I separate the comments with the resources, and I put them all in that guide. I'm super excited about that guide, by the way, because yes. So
Thank you, Alana.
absolutely, I can't thank you enough. This has been so fulfilling, and so I'm so grateful to all of you, and so our attendees. So thank you so very much.
And we're easy to find, connect with us online. I think that's where we build the real relationships is, having the Facebook chats and all of that. I think it's all valuable. So
absolutely. Thank you all so much. Keep the those in attendance. Please send your suggestions in terms of like what you would like to see next, or what you liked about this, and what topics you would like to see in the future. And thank you all, and have a fantastic evening, and enjoy your family. And I know you had to make arrangements for a lot of things to happen tonight. So thank you all so much. All right, thanks.
Yes, thank
Bye,
you.
everybody.
I'll end tonight's webinar. Thanks, everyone.